and welcome to today's edition of the Research Sofa. Today I'm here with Dr. Tim Bradshaw from the University of Manchester. I'll just let Tim introduce himself to you.
Hi, my name's Tim Bradshaw. I'm a reader in mental health nursing at the University of Manchester, and I started my career originally as a general nurse back in the 80s, and then later converted to mental health, where I've worked since. Most of my time in clinical practice was spent as a community psychiatric nurse working in and around Liverpool.
So Tim, can you tell me a bit about how you first became interested in the physical health of people with severe mental illness?
I think it probably goes back, Emily, to the fact that I was originally a general nurse before converting to mental health nursing. And I think my background in general nursing probably makes me see things in a slightly more holistic way than some of my colleagues did. So I think that's probably where my interest came from.
Yeah. And in your opinion, what do you think are the main reasons for the health inequalities that have been observed in this particular population that we're working with?
I mean, I think, as you'd expect, there are probably many factors that adversely affect the physical health of people with serious mental illness. But if I had to pick the three biggest factors, for me, I would probably say smoking, low levels of physical activity, and the cardiometabolic side effects of antipsychotic medication. And of course, the difference between these three factors is that the first two are potentially modifiable by the individual with the right support, whereas the third factor, medication side effects, is obviously less modifiable unless the person prescribing the medication is prepared to take side effects such as weight gain seriously and adjust the dosage or the type of medication prescribed accordingly.
And what have you found with that in terms of people being willing to think about the side effects of medication?
I think a lot of prescribing psychiatrists will take this seriously. But some of them seem to think that it's a kind of trade-off between the effectiveness of the drugs from a psychiatric point of view, and that's more important than the effects on physical health. Personally, I think I don't really think it's acceptable to persuade people to take a drug that is having a really detrimental effect to their physical health. And sometimes I've seen absolutely horrendous weight gain in some of the service users that I've known that have been prescribed some of these medications.
Yeah. So can you tell me about the research you've been involved with around the physical health and also how this has informed your scholarship and teaching at the University of Manchester?
Okay, well, I think probably I'd have to go back to when I did my PhD in 2001. And I wanted to find a topic that really interested me. So I started doing some reading about the poor physical health of people with serious mental illness. And of course, 20 years ago, there wasn't as much in the literature, but that caught my interest. So I decided to conduct some health education groups focusing on physical health for people with a diagnosis of schizophrenia, which kind of, the findings of my PhD were that people were motivated to participate in groups and could change aspects of the behaviour, particularly things like increasing physical activity and eating better diets. They increased their consumption of fruit and vegetables as part of the study. And then after completing my PhD, I was invited to work on a weight management study called HELPER. And this was for people with first episode psychosis. And as I've already suggested, rapid weight gain can be a big problem for people in this population and can have serious both physical and psychological consequences. So in this study, we conducted some qualitative research to find out what sort of intervention the service users wanted. And also we interviewed mental health professionals to find out what they thought was the type of intervention that might be effective. And from that, we developed an intervention which we then evaluated in a small randomized controlled trial involving 100 people, where 50 of them were allocated to the experimental weight management intervention and 50 of them to treatment as usual. And then I guess the next study I was involved with was Scimitar, which was a smoking cessation study for people with serious mental illness. And in the pilot study, we recruited around 100 people, again, who we allocated to either smoking cessation or treatment as usual. And the treatment was delivered by mental health professionals who were specially trained in the intervention. We then went on to conduct Scimitar Plus, as you'll know, which was a large randomised controlled trial involving over 500 people. And in simple terms, our findings showed that with the right support, people with serious mental illness are motivated and can stop smoking. And if they do, we think that should have significant benefits for their physical health.
So quite a wide portfolio of research in the area of serious mental illness so far.
Yeah. I mean, I've enjoyed all the research that I've been involved with, and it really interests me. And I think the idea that we might be able to make a difference to people's health and well-being and reduce these health inequalities is quite important to me. As well as the research, working at the university, I've also developed a module about physical health for people with serious mental illness, for mental health professionals. And 3 years ago, I edited a textbook to support the students with their studies, because the work, I didn't think the textbooks were around were of sufficient quality at the time.
Yeah, so really an impressive array of work, research and teaching you've done. So it's been really nice to have you here on the sofa today with us, Tim, long-standing friend and colleague of the network, and we've worked with you for many years, certainly since I started work at the University of York in 2012, when I first met Tim. So really good to have you here today, and thanks for joining us.
Yes, thanks for inviting me, Emily.